COVID, we're happy to find the answers. We can take them offline, or we can bring individuals in to help address the questions you have. With us today is Sean McLeod, Deputy Minister of Labour and Immigration, and he can assist with any questions on employment standards that you might have that have come up in recent days. I will now turn it over to Dr. Dina Hinshaw.
Thanks, Tom, and thank you all for coming. As Tom said, my name is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Today, I'm here to give an update on COVID-19. First, I want to announce that Alberta is adopting aggressive new measures to limit the spread of this virus. As I mentioned yesterday, COVID-19 is a rapidly evolving public health threat. It is more severe than seasonal influenza and more contagious than SARS. There is a window of opportunity for Alberta to slow the spread of the virus and thereby protect the health of Albertans. Other countries who have faced this crisis have proven that immediate public measures are necessary to prevent the spread of the virus and protect public health. The steps we take now and in the days ahead will help determine the severity of this outbreak for Alberta. These are extraordinary circumstances, and our public health measures must rise to the challenge we face. That is why, effective immediately, the Emergency Management Cabinet Committee has approved my recommendation that all large gatherings of more than 250 people or international events in the province are to be cancelled. This includes large sporting events, conferences, and community events. It does not extend to places of worship, grocery stores, airports, or shopping centres. Any event that has less than 250 attendees and expects to have international participants or involves critical infrastructure staff, seniors, or other high-risk populations should also be cancelled. Events of less than 250 people that do not meet these criteria can proceed as long as risk mitigation is in place, such as sanitizer stations, ensuring that there is a mechanism for keeping anyone ill from attending, and distancing between attendees. At this time, schools and daycares can remain open, but schools are encouraged to avoid large all-school gatherings. In addition to these measures, I am expanding my recommendation from yesterday and am advising all Albertans to not travel outside the country at this time. Given the rapid global spread of this virus, it is no longer possible to assess health risks for the duration of the trip. Also, given the quickly evolving nature of this outbreak, I am recommending that Albertans who are currently outside the country self-isolate on their return for 14 days after they leave the country that they are visiting. That's independent of which location they were in. Finally, I am recommending that any Albertan who is ill with influenza-like symptoms, such as fever or cough, stay at home until 14 days after their illness started. I appreciate that some Albertans may be worried or disappointed at this news. These measures will have significant impact on many people. This is a serious decision which we do not make lightly. This is an extraordinary situation which requires extraordinary measures. We are taking this step based on the ongoing developments outside Alberta, both in the actions being taken by other jurisdictions, as well as the increasing spread of cases around the world. This situation is evolving rapidly, and we know that Albertans will have a lot of questions. We continue to update our website regularly, and we will respond to questions as quickly as possible. We may not have every answer today, but we will continue to provide regular updates. Here at home in Alberta, we continue to work hard to identify new cases and take immediate action on new cases. With respect to the last 24 hours, 4 new cases of COVID-19 have been confirmed in our province. All of these are individuals in the Calgary zone. They involve a range of ages and people who had recently returned from traveling in Jordan, Egypt, France, Germany, and the United States, specifically Florida. One of these cases is a young child who is now recovering at home. The child returned with their family from a vacation in Florida and developed mild symptoms once back home in Alberta. They attended a local daycare last week while experiencing symptoms. This child tested positive yesterday and is now recovering in isolation at home. They are expected to make a full recovery. As soon as the case tested positive, health officials took immediate action to protect the health of this child and other Albertans. On the advice of Alberta Health Services, the daycare has temporarily closed to limit exposure to the virus. All close contacts who may be at risk have been contacted by Alberta Health Services. Those who display symptoms are being tested, and all close contacts are self-isolating for 14 days while being monitored. I want to remind Albertans that anyone who has not been contacted directly by Alberta Health Services is not at risk. As a mother myself, I know that a child contracting COVID-19 may be upsetting for some people. Children are a vulnerable group, and when they get sick, it can hit close to home. I want to assure all parents that cases of COVID-19 in children are typically mild. Despite that, we need to take the same measures for children that we take for any other case. Isolate the person who is ill, find close contacts, and ask them to stay home for 14 days while monitoring their symptoms. In addition to the measures announced today, I continue to strongly urge all Albertans to follow the public health advice that we have been providing. Do not visit long-term care facilities or loved ones in hospital if you are sick with a fever or cough. All Albertans should practice good hygiene, including washing their hands regularly and avoiding touching their face or eyes. Develop a plan for what might need to change if you or your loved ones need to stay home for 2 weeks. Talk with your neighbors and friends to see how you can support each other if any of you are in this situation. There is another important part of preparing, talking to your children. All parents and guardians should talk to their children about this virus if they haven't done so already. As a mother, I know these conversations can seem daunting to many parents. It is important to remember that children look to adults for guidance during new or stressful events. If you do not provide them with accurate information, they will still pick things up at school, on the playground, from television, and online. It is important that all parents talk to their children in a factual, age-appropriate way. Let them know that worrying is a normal and healthy response. Be honest and accurate. Evidence to date suggests that the vast majority of kids who contract COVID-19 experience mild symptoms. Most importantly, parents should make their children feel safe and educate them on everyday actions they can take that will help them reduce the spread of germs. We are developing materials to help parents with these conversations. In the meantime, there are also good resources available online from the BC Centre for Disease Control, the CDC in the US, and others. A public health emergency can have a significant impact on the mental health of children and adults alike. I want to remind all Albertans of the importance of supporting their mental health and the health of those around them. The COVID-19 pandemic will take many weeks and even months to unfold. It's important that all Albertans know that mental health supports are available when needed. Anyone struggling with their mental health can reach out to the Mental Health Helpline, which is available 24 hours a day, 7 days a week. Help is also available across Alberta through your local health services. Children and teens can also call or text the Kids Help Phone at any time of the night or day. This is a free, confidential, and professional service designed to meet our young people's needs. Many health professionals and other Albertans are working very hard, sometimes around the clock, to limit the spread of COVID-19. Given the global spread and our ongoing work to aggressively identify and isolate cases of COVID-19, I expect that we will continue to confirm new cases in the days ahead. Rest assured that Alberta continues to work closely with our health partners and monitor developments around the world. If we need to implement additional public health measures, we will do so. The health of Albertans is, and always will be, our top priority. Thank you again for coming, and I'll be happy to take any questions you may have.
There's one question, guys, so let's just do the hand system.
Sure. What are you recommending for other large gathering places, museums, theaters, movie theaters?
So at this time, any settings where you don't have a large number of people all in the same place at the same time, those settings we're recommending frequent disinfection of surfaces, maybe signs at the door to remind people if they're feeling ill that they shouldn't visit. For a place like a movie theater or a theater, if you have a large number of people over 250 in that space, then that would meet that criteria that we're currently announcing today. Again, we know that there will be a lot of questions about very specific pieces in different scenarios, and we're working to get our website updated to be able to answer those
I
questions.
suspect the schools was a difficult decision. What did you weigh there and why did you decide not to close them?
So with schools, again, that's a decision that we're considering. At this time, we haven't made a decision, but we know that the day-to-day routine of families would be significantly disrupted if we were to close schools. And so at this time, we believe that the most important measure is those gatherings, especially with international travelers coming in, and large gatherings of those more than 250 people. But with schools, we need to take a little more time to consider the impact that those school closures would have and weigh that out against what potential public health benefits we might achieve.
You kind of touched on this, but earlier today we learned the Ontario government has decided to cancel school for 2 weeks following spring break. Is that something the government here should consider?
So again, we are considering the possibility of what we might do with schools, whether that's a closure or other measures. We haven't made a decision at this time, but it is something that's under discussion.
What would be the tipping point for events that are over 50 but under 250 to be canceled?
So if an event is between those two cutoffs, so again, over 50 people, under 250, if that event has people coming from international destinations to attend, if it has attendees, a significant number of the attendees expected to be over 60 or have chronic health conditions, or if the members of that gathering are members of critical infrastructure groups, such as healthcare professionals, we would recommend that those gatherings not go ahead because the risk of transmission within those settings would be great. If that does not meet those criteria, an event within those two numbers could potentially go ahead as long as public health measures were taken, such as ensuring that people who are ill do not attend the event, ensuring that hand sanitizer is readily available, and considering how distancing between participants might be implemented.
How come this recommendation wasn't made earlier? Many events in Alberta have been cancelling for the last few days.
So we know that this announcement and this recommendation will have a significant impact on Albertans. And as I said yesterday, we know that any decision that we take to limit the spread of this virus will not be short-lived. It will extend for some time. We continue to track and monitor the development of the spread of this virus around the world, but we don't take these decisions lightly, and we want to weigh out the potential risks of this action against the benefits. At this point, given the developments over the last day or so, where we're seeing, again, further international spread combined with the incidents like the mass gathering in Toronto, where there was potential exposure out of the mining conference, it's become clear that this is the right action to take, and we are taking it.
We'll go to the phone now for a few, and then we'll come back to the room. Operator, could you patch one through?
The first question is from Keith Guerin with the Edmonton Journal. Keith, your line is open.
Hi, Doctor. Thanks for taking my question. I think a lot of the other reporters in the room there will identify that there's a lot of bad information out there on social media and elsewhere right now. People with miracle cures, people who say we shouldn't listen to people like you, that the public health officials are fear-mongering and so on. What is your role, what is the government's role here in countering that bad information and getting people to trust what you have to say? What's the strategy there?
So it's a really good question, and certainly the spread of misinformation is a big challenge that we're experiencing not just in Alberta but around the world. What we're trying to do is to be very available. So again, having daily availabilities where I'm happy to take questions. We also make sure our website is updated regularly, and we're tracking what kinds of questions people have and making sure that that content then is updated on our website. We're also working to get content out into social media realms. We know that often in social media, that can be where people are sharing information with each other, and we're wanting to make sure that the content that we have is very obvious in those venues. Also, nationally, we're working with our partners across the country, including other provinces and territories and the Public Health Agency of Canada. And with respect to the federal government, the Public Health Agency of Canada has been working with platforms like Facebook to make sure that the algorithms put the reliable information up front and center. And so, again, nationally, that work is being done to try to highlight that this is a serious issue, and this is something we all need to take very seriously, given that we have no vaccine, we have no preventive medication for this particular virus. We are each other's best protection, and measures like this are what will help us protect our Albertan population and prevent spread.
Operator, could you patch through the next question?
Next question is Michelle Pinault with Vegreville News. Michelle, your line's open.
Sure. I just wanted to know how many confirmed cases does the community have to have before additional measures, like an isolation center, would be required?
So again, good question. With respect to the number of cases, I think it's not so much the number of cases as the situation that would determine when we might put additional measures into place. So at the moment, I want to remind everyone that all of our cases so far have been travel related. We certainly are watching to see if there is any spread in the community. We have not identified that to date. And so we are monitoring very closely. If we should see the risk in a particular community expanding, then additional measures could be put into place. But at the moment, really, it's not so much about the total number as it is about the risk that those individual cases pose. And at the moment, we've been able to put measures in place that are appropriate to have those people who are ill stay at home, and those who are close contacts make sure they have places to go where they can self-isolate for 14 days. If that were not to be the case, we would need to consider alternate measures. And again, we continue to monitor the situation and assess whether or not these kinds of alternate measures are needed in the days ahead.
Legislature's back on Monday. What would you recommend for the politicians?
So again, the same recommendations with respect to what I've just outlined would apply in any setting. So it would be a matter of looking at the numbers, looking at the distances, so distancing measures that might be able to be taken, hand sanitizer, those kinds of things. So again,
in the house, though, it's 87 there, plus people around, but there's a lot of people coming in and out of the ledge. What would your recommendation be? Because it could be 250 at some point there, but it seems a bit high.
yeah, so again, these recommendations are going to be taken into account and assessed to see how they might apply in different situations. The legislature would be one such setting, and so I think we can anticipate that there will be more to come on that as this recommendation rolls out and takes effect.
You mentioned you're considering closing schools, but what are the specific factors that you would be looking at when making that decision?
So there's some debate about the effectiveness of closing schools depending on where children would go if a school was closed. So if children are in a setting where there's many children together, such as an after-school care program or something like that, we need to know if closing the school will actually just shift those groups of children to another location, or if we can find ways for them to be accommodated in ways that wouldn't continue to have that risk of children close together. And so some of the factors that we need to determine are whether or not there are measures that can be taken within schools to reduce risk without closing schools, or if for a period of time school closure might be the appropriate way to limit spread. So again, it's just a matter of assessing within our current society structure where many parents both work, where would those children go, and would that in fact reduce the risk of spread, or would it be about the same? And those are the kinds of things that we need to consider.
Universities? Or are you mainly talking about public schools?
So the deliberations would be at this time public schools. Certainly universities are another question that, again, there's lots of deliberation about. And at the moment, the recommendations that we have here do not apply to those settings. However, those are topics that we will be discussing in the days ahead.
Reminder to everyone, we are going to do another update tomorrow. Some of these details we can continue to update you on.
Are there any preparations underway to open a new assessment center? We've heard that there's one that might open in the same building as Cardinal Collins School.
So what I know is that Alberta Health Services is continually monitoring the volumes of requests for testing and whether or not their assessment centres are able to handle those volumes. And so if they're feeling that they, in any one particular location, are needing to expand their capacity, then they would make that decision at a local level. So that's something that is part of that local response based on the need and what infrastructure they have available. So I wouldn't be able to comment on specific locations, but just to say that Alberta Health Services is continually monitoring their volumes and what they need to do to manage those.
Janet?
Yes, two unrelated questions. We've heard from Edmonton Police that 911 is getting a lot of calls about COVID-19 coronavirus. Have you heard any sort of more provincial picture of that, and what recommendation would you give about people calling 911 for information about this?
So I haven't heard if that's a provincial issue. Certainly, I know that with the volumes of calls that are going into HealthLink, that people are experiencing longer wait times than would be ideal. Alberta Health Services is working very hard to accommodate that. The volumes have gone up by over 50% in the last few days. And so again, as I'm sure people can appreciate, this is an extraordinary situation, and all efforts are being made to reduce those wait times. In the meantime, what I would say is if an Albertan is worried about their immediate health, if they're having difficulty breathing or some other kind of health concern for which they need to call 911, then they absolutely should do so. If they're worried about having had an exposure to COVID in addition to those critical symptoms, they should tell 911 about that so that that response team is prepared. If an Albertan is not experiencing critical symptoms, such as, again, having extreme difficulty breathing or any other symptom that would mean that they need immediate critical medical attention, I would ask that people continue to use 811 as the best place to get advice and assessment. Even though wait times are long, that continues to be the best place. So I would just ask Albertans to be patient, to continue to use that resource, and to not use other resources that need to be reserved for critical illness.
All right, we're going to take a couple from the phone. We'll come back to the room, guys. Operator, could you patch one through?
Next question is David Staples with the Edmonton Journal. David, your line is open.
Hi, Dr. Hinshaw. I think you've made it clear already that there's no community transmission yet in Alberta. So I'm wondering, in terms of triggering this latest, these aggressive measures, as you're calling them, what are the one or two things that really persuaded you it was time to move to this more aggressive stance?
So as we've been investigating cases over the past week, one of the things that's become clear is that we have many cases coming in from the United States, and cases who, when they came home, may not have considered themselves to be at risk, and so went about their business because they didn't come from a country that was known to be a concern. We know there's a lot of travel back and forth between us and the United States. And so again, as we're doing these investigations, we thought this measure is appropriate at this time, given the number of cases that we have that have come in from that destination, the number of cases from other parts of the world, that we think we need to act aggressively and quickly to make sure that we're not delaying that decision too long. So again, really it's about seeing those cases come in, seeing the increase in international spread, and recognizing that the risk of waiting is greater than the risk of implementing these measures now.
Excellent. Operator, could we patch through another question?
Next question is Brittany Gervais with the St. Albert Gazette. Brittany, your line is open.
Hello, thank you for taking my question. People in our community are a bit nervous about going to public pools. Can you explain if the virus can be spread through water and if people are still safe to go to these public places?
So the virus would not be spread through water. It's person-to-person transmission through coughs or sneezes, or it can be if somebody has coughed or sneezed and those droplets land on a surface. If someone touches that surface and then touches their face, then that's potentially how they might pick it up. But from drinking water, it wouldn't be a risk. The one thing I will say, though, is if people are sharing water bottles, sharing lipstick, sharing any kind of object that moves from one mouth to another, that would be a risk. So water bottles would be the only way that water would be an issue, is if someone is actually sharing a cup or a water bottle and drinking from that same container. With respect to schools, certainly we know, as I mentioned earlier, that children in China and in other places who've had COVID-19 have had relatively mild disease. So that's encouraging. However, we also know that children can potentially spread that mild disease from one person to another. At the moment, we have no evidence of any school in the province where there has been a confirmed case of COVID-19. So there's no current school setting where we consider that to be a risk. So again, as we're making these decisions about whether or not school closures might be implemented, these would be precautionary and not related to a specific exposure that we're currently aware of.
All right, guys, I know there's 4 questions, so we're just going to go through them in turn order. I saw the hands. Julia?
Should the province have made the recommendation for anyone coming back from any type of international travel to self-isolate? Should they have made that recommendation earlier as opposed to now?
So again, these are measures that we discuss at great length with colleagues at the provincial and territorial and federal level, because we know that these measures will have impact on those people who are returning. And so the question of the timing of these things is never taken lightly. And that's, again, why we have deliberated over the correct measures to take. And today we feel that that's the appropriate measure at this point in time to recommend this measure. But again, the question of timing is one that is always a part of those discussions, because we know that there are impacts and risks to people who have to stay home for 2 weeks, in addition to the impacts and risks of spread of the virus.
Is the risk of contracting coronavirus in Alberta still considered low at this point? I notice it's not in the release.
So I would say that the risk of exposure to COVID has not changed from yesterday to today. What has changed is the concern that we will continue to see international travelers bringing in cases of coronavirus. And I would say that, again, not different from yesterday to today, the risk to a vulnerable Albertan who might contract the virus would be significant in terms of their health outcomes. So it isn't articulated in that news release at this time. Again, that hasn't shifted, but we do believe that the potential for that to change over the coming days is growing. And so it's sort of a complex risk assessment. It's hard to say if it's just low, moderate, or high, because it's about exposure, it's about consequences, and so that's why it's not in there, because it's getting more complex.
All right, we're going to go to Dean and then Janet.
Sorry. Doctor, can you just, I might have missed this off the top, but your release says you're asking people not more than 250 to cancel, but Cabinet's already approved this, isn't it?
So the Emergency Management Committee of Cabinet has approved my recommendation that we go down this road. So we are recommending this at this time as a formal recommendation. If there are organizers who choose not to comply, then we would consider what measures we would need to take. But we're expecting that organizers, as we've seen in the past few days, there are many organizers who've proactively canceled their events, because I think that people are concerned about the attendees for the conferences that they're organizing or the different events that they're organizing. And I think most people want to do the right thing. So at this time, it's a recommendation. However, if it were needed to make that a requirement, then we would investigate the appropriate mechanisms.
How much force of law does this have? So if I decide to have 280 people at my event, I can do that, or can I, or what can I expect the province to do?
So under the Public Health Act, we do have mechanisms to ensure that it is required that people follow this recommendation. So again, if we find that that's a significant problem, that people are not following their advice, then we would have legal measures to take to compel them to follow the advice.
What legal measures are those?
Again, it would be under the Public Health Act with respect to...
Are we talking about fines? Are we talking about what legal measures will you be taking if more than 250 people decide to gather?
So,
what options do you have available?
Right. So the mechanism, and again, maybe we can get back to you with details, but really it's an order from the Chief Medical Officer of Health that would be province-wide in scope. And so then the fines that might unfold from that, or the consequences for not complying, we'll have to get back to you on that with respect to what might happen. But again, I want to emphasize that from what I've been hearing from Albertans and from what I've been seeing with respect to people already making decisions, I believe that people want to do the right thing and they want to participate, because again, these are the only measures we have against this virus, is how we help each other to not be exposed.
Dean, I can definitely get you that background info. Yeah, for sure.
I'm just
Janet?
looking for some clarity on people who are returning to Canada, including from the U.S. Are you saying everyone who comes back to Canada should self-isolate for 14 days, or just the 10 target countries or whatever that original list was?
Everyone. So that would include the United States. So anyone who is currently outside of the country, of Canada, and comes back to Alberta, we're recommending that they self-isolate for 14 days following their return from any country in the world.
All right, thanks, guys. Dina has another engagement. I know it's a lot. We'll update you again tomorrow. So thank you for coming. And if you have any follow-up questions, same time tomorrow. If you have any follow-up questions, reach out to me, and we can definitely track it down for you. Yeah. I believe so, but we'll confirm as of, yeah.
Yeah.
Thank you very much.